Part of it is, I guess I would categorize as selfish. It's for me. I don't want to have Parkinson's if I don't have to. But part of it also is for my kids. I firmly believe that by the time they're at an age where they might develop Parkinson's, the disease will be gone.
Genetic research is really going to be key to helping researchers understand more about the condition and eventually developing better treatments for Parkinson's disease.
We don't understand everything about why that gene causes Parkinson's. We want to understand it better. Well, we're going to take people and we're going to study these biomarkers. And we're going to understand better the process from having the gene to getting the Parkinson's. And that will generate ideas about new treatments because we'll understand the mechanism better.
I have the GBA mutation, and I've heard a lot about clinical trials that have been starting, and I was waiting for one that would have a connection to GBA, which would make it more specific for me. There is one that just started about 4 months ago, and I am participating in that. Somewhere between 5 and 7% of Parkinson's patients have the GBA mutation, but I think 50% have reduced GCase, which is the enzyme that is affected. So if there is some kind of therapy or cure developed for GBA, chances are it will help a big portion of the Parkinson's community.
The odds are with these genes that you'll live your entire life and never get Parkinson's. So you're a gene carrier, but you're fine. Why? So maybe it's GBA plus something else that gets you to Parkinson's.
I decided to get my family together. I have 4 sisters and my daughter. We sat down, I told them I have this LRRK2 mutation. I just wanted to ask them if they would be interested in being tested. There are so few people who have the mutation that I thought that this would be a great way for them to help us move research forward.
I talk with a lot of different people, and I think the concerns might depend on how is the information going to be used, and just having them think about the pros and cons of undergoing genetic testing.
Well, I have this buddy in Boston. His brother and his father had Parkinson's, so he has done a lot of thinking about it. And I asked him if he'd gotten genetically tested, and he said no. And I launched into my whole story or my whole philosophy about why it's an important thing to do, because the more information you can collect about yourself and contribute to a kind of a pool, a database of knowledge about humans, the more likely we are to come up with therapies or cures.
People, first of all, they want to know it's anonymous. So I think that confidentiality issue is very important to people.
Some people may be concerned about their genetic test results in regards to their employment. The Genetic Information Non-Discrimination Act helps to protect people in those circumstances.
Other people are very cautious. If I know my gene status, will it affect my treatment? And then the other part is, do my kids want to know? And I've had patients tell me that before they even think about it, they want to talk to their kids. I send my patients to a genetic counselor before they go for genetic testing. I find that it eases the whole process.
Some people get really nervous about the term counseling, but we are here to help support people and answer their questions.
Finding out about your genetics can be kind of scary. It was wonderful to be able to talk about what was going to happen.
I love the patients being involved in figuring out not just the name Parkinson's, but what's really going on. What I hope happens, and I see it happening, which is why I am so optimistic, is that we're in a different era. I saw it happen in MS, I saw it happen in stroke, and it's going to happen in Parkinson's.